This vitamin dissolve blood clots in your legs. Seniors must know. Have you ever noticed your legs feeling strangely heavy as the day winds down, or found your feet colder than the rest of your body, even when you're wrapped in a warm blanket? Maybe you've brushed it off as just age or a long day, like so many of my patients do. But sometimes, these quiet discomforts are more than just passing annoyances. They're whispers from your body, gentle, persistent nudges that something in your circulation may not be working as well as it once did. I've spent over 3 decades sitting with people like you, listening not just to their words, but to what their bodies are trying to say. And I've learned this: when we listen early, we can prevent so much pain later. You don't need fear to take better care of yourself. What you need is understanding, clarity, and a little encouragement from someone who's walked beside many others on this road. So if you've been feeling more fatigued lately, or if your legs and feet are acting a little off, don't ignore it. Let's take a gentle, thoughtful walk through your circulatory health together, because how your blood moves shapes how you live. Come with me. Let's explore this together. Part 1. Why circulation matters more than we realize. I want you to picture something with me. Imagine your body as a quiet town, filled with homes, gardens, and winding roads. Now imagine your blood as the mail carrier. It delivers oxygen, nutrients, and healing signals to every corner, every little house in this town. When those roads are open and flowing, everything works in harmony. But when traffic builds up, deliveries get delayed, trash piles up, and the whole town begins to slow down. That's what happens when circulation begins to falter. We often think about the heart, its beats, its rhythms, whether it's strong enough. But what we forget is that the heart is only half the story. The blood vessels, the tiny capillaries in your legs, your feet, your brain, your hands, they're the highways and alleys where life actually happens. And when those roads narrow, harden, or become blocked, your organs, muscles, and nerves quietly begin to suffer. I've seen it too many times. A patient comes in complaining of tired legs. "Doc, it's just age," they'll say, but then we check. And it's not just age, it's a slow loss of flow, a loss of vitality, a loss of protection. Poor circulation doesn't always start with drama. It starts with subtle signs: cold toes, swelling after sitting, even the color of your skin changing ever so slightly. The problem is, many of us wait until those whispers become shouts, until the wound doesn't heal, until the cramps wake you at night, until the doctor uses words like ulcer or blockage. But it doesn't have to be that way. If you begin to notice even small changes in how your legs feel: heaviness, aching, discoloration, numbness, I encourage you not to ignore them. Think of it not as a crisis, but as an invitation to tend to the beautiful highways within you before the bridges break. And don't worry, we're not jumping to big prescriptions or scary tests. In fact, in the next part, I'll show you one of the earliest clues your body might be giving you: the color of your skin. Yes, your skin might be speaking for your blood vessels long before pain ever arrives. Shall we take a closer look? Part 2. Skin color changes. The body's silent language. Let me ask you something you may not have thought about recently. Have you ever looked down at your feet and noticed that they seemed a little off in color? Maybe a pale patch around the ankle, or a bluish tone that lingers more than it used to. Some people even see darkened spots or reddish bruises without remembering a bump or fall. It might seem harmless, just thin skin, right? Or the result of sitting too long. That's what many of my patients assume. But as a doctor who spent years watching these small changes turn into big ones, I can tell you this: the skin can speak long before pain does. You see, when blood doesn't circulate well, especially to the lower parts of your body like your feet and ankles, oxygen can't reach the tissues properly. And when oxygen is low, the skin's color begins to change. pale or bluish skin can mean slow or restricted blood flow. Reddish or brown spots may point to leaking capillaries or tiny vessels breaking down under pressure. I once had a sweet gentleman named Harold, 76, who came in thinking he had a foot fungus because his toes were discolored. It turned out to be poor blood supply. Thankfully, we caught it early. With a few adjustments and some natural support, he was walking better in just a few months. This is the beauty of paying attention. You give your body the chance to recover before the damage becomes deep. But if we ignore these signs, if we assume it's just aging, those minor changes can open the door to ulcers, infections, even tissue loss in severe cases. So tonight, after your shower, take a quiet moment. Look at your feet not with worry, but with curiosity. Are they warm and pink, or do they seem dull, dry, or bruised looking? That simple habit of observation can make a bigger difference than you realize. In the next part, we'll talk about a symptom many people wake up to: cramps, especially when walking or at night. It's not always dehydration. Sometimes it's your muscles begging for more blood. Part 3. Cramps that interrupt your steps or sleep. Have you ever taken a walk, maybe just around the block or through the grocery store, and suddenly your calf tightens with a sharp cramp? You stop, stretch, maybe shake your leg out a bit. I must have stepped funny. You think, then it happens again the next day, or worse, at night while you're resting in bed, it seizes up and jolts you awake. These aren't just ordinary muscle spasms. They can be one of your blood vessel's earliest cries for help. Cramps that come on during movement, especially in the legs, may signal something called intermittent claudication, a condition where the muscles aren't getting enough oxygen-rich blood during activity. It's usually caused by narrowed arteries, a sign that circulation isn't keeping up with the needs of your muscles. I remember a kind woman named Ellen who used to love gardening. She came in and told me she couldn't even water her roses without stopping to rub her legs. "It feels like my muscles are too tired," she said. But they weren't tired. They were starved for oxygen. With a few simple changes, we brought flow back, and by spring, she was out planting again. The danger is when we dismiss these cramps as just aging or not enough water. While hydration and stretching do matter, persistent cramps, especially when walking or sleeping, may point to deeper issues. Why does it happen at night? Well, when you lie flat, circulation patterns shift and reduced flow to the lower limbs becomes more noticeable. Your body isn't moving, but your muscles still need blood to repair and recover. Without it, they spasm. Left unchecked, these cramps may evolve into more serious discomforts, chronic leg pain, difficulty walking long distances, or in worst cases, tissue damage due to lack of blood. So if you're noticing more of these nighttime interruptions, or you're cutting walks short due to leg pain, don't push through in silence. These aren't inconveniences. They're invitations to pause, reflect, and care for your circulation. Next, let's talk about a symptom that's often ignored because it's painless, but no less important: that tingling or numbness in your feet and legs. You might think it's just posture, but what if it's more? Let's explore that together. Part 4. Tingling and numbness. When your nerves begin to whisper. There's a quiet sensation many people brush off, one that often shows up when you're sitting too long or standing in line, a strange tingling in your feet, or that pins and needles feeling that seems to spread without reason. Sometimes it fades when you shift position. Sometimes it lingers. What I want you to know is this: when tingling and numbness become regular visitors in your legs or feet, they're not just annoyances, they're messages. Your nerves, just like your muscles, rely on steady blood flow. Without enough oxygen and nutrients, those tiny nerves, especially in your lower limbs, start to struggle. At first, they whisper with tingling. Then they begin to go quiet altogether, leaving you with dullness, imbalance, even unsteadiness when walking. I once cared for a man named Thomas, 81, who told me he tripped over his own foot while walking down the hallway. "I didn't feel it catch the rug," he said, with surprise in his voice. "What we discovered was peripheral nerve stress from reduced circulation. His body wasn't sending the right messages from his feet to his brain, and it nearly cost him a fall." This kind of nerve compromise is common in people with diabetes, high blood pressure, or long-term circulation issues. But it can begin quietly in anyone, especially as we age. And here's the gentle truth. If you wait until your feet are fully numb or your balance is affected, healing becomes much harder. But when you act early, support is still possible through nutrition, movement, and mindful habits that protect your vessels and nerves. So don't ignore that tingling. And don't dismiss it as just sitting wrong. Your body speaks in subtleties long before it cries out. Coming up next, let's talk about one of the most common and overlooked signs of circulation problems: cold feet even on warm days. Is it really just a quirk of getting older, or is something else going on beneath the surface? Let's find out together. Part 5. Cold feet. A clue from the extremities. Have you ever sat in a cozy room, wrapped in your favorite blanket, and still found your feet icy cold? You might think, well, I've always had cold feet, or it's just my age. But as someone who spent a lifetime listening to the body's quiet messages, I'd invite you to pause and ask, is it really just the weather, or is it my blood flow? You see, your feet are the farthest points from your heart. They're like the end of the line in a train system. And when circulation weakens, the blood may not reach those distant stations efficiently, especially in your toes and soles. When the vessels in your legs begin to narrow or harden, less warm, oxygen-rich blood makes it down to those ends. The result, that cold, almost numb feeling, even in the middle of summer. I remember Mary, a 70-year-old former school teacher, who told me she wore socks to bed every night even in July. "It's just a silly quirk," she laughed. But we later discovered that her arteries were becoming less flexible. With just a few adjustments and a bit of support, she didn't need those socks anymore. The danger here isn't the cold itself, it's what the cold means. Cold feet can be a signal that your circulatory system is underperforming, especially if you also notice slow healing cuts, dry or cracked heels, or toenails that grow more slowly than usual. If left unattended, these small changes can lead to bigger risks: ulcers, infections, and, in extreme cases, even tissue damage. But don't worry, we're not talking about extreme treatments here. Often, the first steps are gentle: a warm foot soak, a brisk walk, or a daily habit that boosts blood flow naturally. Next, let's move to something a little more visible: those small, winding veins that creep up under the skin, varicose and spider veins. They're not just cosmetic, and I'll tell you why in the next part. Part 6. Spider and varicose veins. What the surface is telling you. Let me ask you something many folks hesitate to talk about. Have you ever looked at your legs and noticed winding, bluish veins just beneath the skin? Maybe they bulge a bit after standing too long. Or maybe you've seen tiny red or purple lines near the surface, like little spider webs. Most people shrug and say, it's just cosmetic, nothing serious. But those veins, they're not just about looks, they're clues. Spider veins and varicose veins are visible signs that blood isn't flowing as smoothly as it should. Normally, your veins have tiny valves that keep blood moving upward toward the heart. But as we age, or if we stand or sit too long, those valves can weaken. Blood begins to pool, especially in the lower legs, stretching the vein walls and creating that bulging, twisted appearance. I think back to Mr. Alvarez, a retired truck driver who came to see me because his legs felt heavy and sore by dinner time. He figured it was just from years behind the wheel. But his varicose veins were more than old age. They were signs of venous insufficiency, a condition where the blood struggles to return to the heart. When we ignore these signs, it's not just discomfort that sets in. Over time, this pressure can cause swelling, skin changes, and even open sores called venous ulcers. And believe me, those are not easy to heal. But here's the hopeful part. When caught early, we can do so much with small, daily actions. Elevating your legs for 20 minutes in the afternoon, wearing gentle compression stockings, even taking short walks every hour if you've been sitting a long time. These aren't drastic, they're kind, simple ways to give your veins the support they need. Professor Joel Mendez, a colleague I deeply respect, once said, "We treat varicose veins too late because we treat them like decoration, not diagnosis." He's right. Our body leaves clues on the outside when something deeper needs attention. Now that we've talked about signs, what about solutions? In the next part, we'll explore 4 powerful vitamins that nourish your blood vessels and gently bring circulation back to life. Part 7. The 4 essential vitamins that support your circulation. Now that we've walked through the early signs your body might be giving you, let's gently shift from concern to care. Because here's the beautiful truth, even if your circulation has slowed a little, there are natural ways to nourish it, starting with what you put on your plate. Over the years, I've come to deeply appreciate how 4 simple vitamins found in everyday foods can quietly strengthen our blood vessels, improve flow, and even ease some of those symptoms we've talked about. Let me walk you through them gently, one by one. 1. Vitamin B3, the vessel opener. Niacin. Think of vitamin B3 like a warm breeze that helps open up narrow pathways. Also called niacin, it naturally helps dilate blood vessels, improving how blood flows through your body. When vessels widen gently, more oxygen and nutrients reach your muscles and nerves, easing cramps, fatigue, and even that heavy leg feeling by evening. But B3 does more than just open blood flow. It helps balance cholesterol too. It lowers LDL, the bad kind, and boosts HDL, the protective kind, keeping fatty buildup from clogging your arteries. Where to find it? Skinless chicken breast, wild-caught salmon, tuna, eggs, and almonds are rich in niacin. A 3-ounce serving of grilled chicken can provide over half of your daily needs. Now, a small note of caution. High-dose niacin supplements can cause a flush, a warm, red, tingling sensation. It's harmless but uncomfortable for some. That's why I always suggest food sources first. Nature tends to be gentler than pills. 2. Vitamin C, the vessel protector. We often think of vitamin C as the cold-fighting vitamin, but it's also a circulatory powerhouse. It protects your blood vessels by keeping them strong and flexible. It supports collagen production, the structural protein that holds your arteries and veins together. Low collagen can lead to weak, bulging vessel walls, which is how varicose veins start. Vitamin C is also anti-inflammatory, helping reduce swelling in your legs and that dragging, achy feeling after a long day. Best sources: citrus fruits like oranges, lemons, and grapefruit, but also kiwis, strawberries, red bell peppers, and broccoli. Guava, surprisingly, packs even more vitamin C than most citrus fruits. Just remember, vitamin C breaks down quickly with heat and air, so eat these foods fresh and raw when you can, maybe a bowl of mixed fruit in the morning or a crisp salad at lunch. 3. Vitamin K, the blood flow balancer. This one often flies under the radar, but vitamin K plays a vital role in circulatory health. It helps regulate how your blood clots, not too much, not too little. That's important because poor circulation increases the risk of both bleeding and clotting problems. Vitamin K also prevents calcium buildup in arteries, which can stiffen your blood vessels and raise blood pressure. Where to find it? Dark leafy greens like kale, spinach, arugula, and collard greens are top choices. You can also find small amounts in broccoli and Brussels sprouts. One of my favorite simple recipes: a green smoothie in the morning. Blend a handful of kale, half a green apple, some kiwi, a stick of celery, mint, and a slice of ginger. It's refreshing, packed with K, and a lovely way to start your day. Now, if you're on blood thinners like warfarin, don't avoid these foods. Just keep your intake consistent so your doctor can adjust your medication safely. 4. Vitamin E, the vessel shield. Finally, we come to vitamin E, the protector of your arteries. It's a powerful antioxidant, helping fight oxidative stress, a type of cell damage that weakens blood vessels over time and accelerates aging in your vascular system. Vitamin E also improves your body's production of nitric oxide, a natural compound that helps blood vessels relax and widen. That means lower blood pressure and smoother blood flow. Good sources: avocados, especially the darker green flesh near the skin, extra virgin olive oil, sunflower seeds, pumpkin seeds, almonds, and leafy greens like spinach. A small handful of raw almonds or a drizzle of olive oil on your salad goes a long way. Just like with vitamin B3, I advise against high-dose supplements too much. Vitamin E can increase bleeding risk. But food sources: safe, gentle, and deeply nourishing. So you see, improving circulation doesn't have to start in a pharmacy. It can start right at your dinner table. With consistency and care, these 4 vitamins can quietly rebuild strength from the inside out. In our final part together, I'll help you connect the dots so you know what to do next and how to keep your legs, your heart, and your life moving freely. If you've made it here, thank you for your time, your attention, and most importantly, your care for yourself. What we've explored today isn't just about feet that tingle or veins that swell. It's about something deeper: your independence, your energy, and your ability to keep living life on your terms. Poor circulation doesn't always shout. Sometimes, it comes as a quiet numbness, a little cramp, or a patch of cold skin. But those are not just signs of aging. They're your body asking gently for support. And support doesn't have to be complicated. It can be as simple as a walk in the morning light, as nourishing as a handful of almonds, as healing as putting your feet up in the afternoon and breathing deeply. We've talked about 4 vitamins, B3, C, K, and E, not as magic cures, but as everyday companions that can keep your blood flowing, your legs moving, and your heart beating strong. So here's my gentle encouragement to you. Start small. Start now. Start with love. Your body is always trying to heal. All it asks is that you listen and respond. And if this message helped you feel more hopeful, more seen, or more in control, would you share it with someone you love? Leave me a comment. How are your legs feeling today? What's one thing you'll try this week, because better circulation starts with better attention. And better attention starts with you. Thank you for letting me walk this path with you. Until next time, take care of your heart, your legs, and your beautiful, resilient self.